So my name is Matt Meyer, and I'm the program director for the Insight program. And the Insight program is a drug and alcohol treatment center located in Roswell, and we work with adolescents and young adults. So the age groups that we work with is ages 13 to 17 and 18 to 25. Um, you asked the question before we started talking about the opiate epidemic and how it's affected the population that I see, and really over the past 10 to 15 years, um, we've seen a really steady incline in opiate use. So I first started noticing it probably 2007, 8, 9 is when I really started to see an uptick in young adults with opiate addictions. And it just steadily increased from there. Um, and and truly, I would say it took until maybe 2014, 15, 16 till it really gained the attention of the media, the national media, shining a spotlight on how bad the opiate epidemic had become. Um, and then over the course of the past couple of years, there's been a large uptick in overdose deaths because of now fentanyl is not just supplemented in heroin products, which was more of your traditional, for lack of a better word, opiate addiction with the young adult population. But now they're putting fentanyl in all types of counterfeit pills that kids get their hands on, anything from counterfeit Xanax to uh, opiate painkillers. And so a lot of the prescription, or so what they think are prescription pills that kids are getting high off of, oftentimes are counterfeit, and a uber small amount of fentanyl can be lethal. And it's not like they're using proper, medical facilities or tests or measurements. And so what used to be um, overdoses happening pretty much exclusively in the opiate addiction population, which we saw a huge uptake in young adults over the past, decade or so, like we talked about. But now we're seeing overdose deaths happen with even the adolescent population, or people that weren't opiate addicts. Maybe they went to a party and got their hands on Xanax that was counterfeit that had fentanyl in it. And I've seen that happen more and more over the past several years. So it really is a growing concern.
Yeah, that's um I think it's really like I feel like people don't realize how because it's not like any type of drug. It's like their opioids are different and they can be prescribed, which makes it really difficult for people.
Hmm. And the you know oftentimes, so the opiate epidemic first really hit the national media and people were talking a lot about it. The common thread was, so and so was prescribed painkillers, and you know that morphed into an addiction to opiates, and then that morphed into heroin addiction. And certainly that was the case for a lot of people. But what I saw more often than not with the younger population was it wasn't that they were, prescribed an opiate and they got addicted to it. They were partying, they were getting high, and started abusing, uh, you know, someone else's prescription opiates, and then that's how it kind of turned into an opiate addiction. And the other point that I make a lot, that I think is really important, is so at different points in time, I'm trying to give you an average. So our young adult treatment program, that's 18 to 25-year-olds, that's where the most opiate addiction lies, because we also do adolescents. And sometimes our opiate population can get as high as it's sometimes at its highest, it's been 80% of our young adult population is here for opiate addiction. Um, right now, if I would do just guesstimating based on the kids that are in there right now, probably 50% of them have opiate addiction. And it fluctuates obviously month to month, but always a high percentage. And if you were to ask any one of them, and the median age in my young adult program is probably 21 or 22, if you were to ask any one of them, what were you doing at, you know, 14, 15, 16 years old? What do you think every one of them says?
They were
And that's
partying, probably.
in specific, what drug do you think they often say they were using at that age?
Is it like
Mm.
nicotine or fentanyl or?
Marijuana.
Oh, wow.
So there, to me, there's a connection there. That doesn't mean everybody that tries marijuana or THC products is going to wind up an opiate addict. I don't want to be misquoted, but what happens is so much of the young population, just due to the age and their brain not being fully developed, um, will can have a tendency to have more of an addictive personality. And so if they start abusing THC products and they have that addictive personality, there's a high probability that it's going to progress. Um, and so, I scream that from every mountaintop to every speaking engagement I talk at. Like, hey, you come up to Insight tomorrow and interview all the young adult opiate addicts, and like clockwork, pretty much almost every time, if you ask them, what drugs they were using at 14, 15, 16, every one of them says, marijuana or THC products. So I think that's an important conversation that's less had about the opiate epidemic that I think is important because prevention's key.
Yeah.
So what do you think are ways that that could be done to like possibly mitigate this issue for like a lot of the teenagers, since like you said a lot of teenagers get their get like marijuana from like partying and stuff. Like how do you think we could try to like mitigate this issue that from occurring?
I think better education in terms of the harmful effects of obviously drugs, fentanyl, opiates, like of course, but also educating kids on the harmful effects of THC and marijuana products. Um, Unfortunately, they get bombarded with so much bad information about marijuana and THC that's really factually incorrect. Um, and like it's good for you, and you should do it. Everybody's doing it. It's getting legalized everywhere, and there's no harmful side effects. As a matter of fact, it actually helps you do better in life, right? I always joke with parents that like you could Google marijuana and probably, I mean, I haven't looked, but probably the first 3 pages is pro, you know, marijuana propaganda. And you might have to get to like the fourth page before you get to like the .gov or the university study that's saying like, well, actually, like there's definitely a lot of harmful effects with marijuana in youth. So I think providing more education to young people, even going all the way to down to the middle schools and elementary schools, and what's real about marijuana. But it's hard because when you're talking to teenagers, when you're talking to middle schoolers, it's easy to become the teacher on Charlie Brown. You guys remember, right? And to get tuned out. So the messenger is really important, and how we deliver the message is. I mean, I remember being a kid and sitting in some of the Dare and the Just Say No campaigns and all those things, and I mean they were good. I don't think they were bad. Don't mishear me, but sometimes if the message becomes too much like just one more version of don't do this or do that, or just like then sometimes young people have tendency to just tune it out. So I think being really thoughtful and intentional about how we're delivering that message to young people, and making sure that it's stuff that they respond to and are listening to, is really, really important.
I think also sometimes when you try to tell, like, I guess, adolescents to not do something, they're gonna wanna
Right.
go around and
Like,
do that. Like, they're
oh,
gonna
I was that kid.
yeah.
I was that kid that was sitting in the anti-drug campaign in my class in high school. High, I was sitting in the back of the class, high, laughing. I was that kid. That you're describing. That you tell me not to do it, I'm going to do it. That's why I said it's really important how we deliver the message. So it's not just drugs are bad. I don't know
Yeah.
if you guys ever watched South Park, but the counselor, Mr. Mackey, like, drugs are bad. Okay. Like if it just becomes that, then people start to tune, young people start to tune it out. So it is important how the message is delivered so they can really hear how important it is for them to know that most of the crap that they read about THC and marijuana is inaccurate. And it is very harmful to their brain, to their emotional development. And all the science and data says that, addiction starts at a younger age. And I don't know what the exact odds are. I could look it up later, but essentially, if you start your substance use as an adolescent, your likelihood of using any substances, marijuana, alcohol, your likelihood of it morphing into addiction if you start younger is really, really high, as opposed to if maybe your first venture into those things happen when you're a little bit older in life. Um, so so getting out that message is super important.
Yeah, for sure. Okay.
And so a lot of the teenagers that you have as like your patients, I guess. So what does like the treatment plan usually like look like for them? Like what is their like recovery journey like?
Like what is I don't understand the question. What does their treatment plan look like? And then you said, what does their recovery look like? Is that what the other part of the question that you said?
Yeah, so like I guess what I'm trying to say is like what is the process that you have to that you go through to like treat them, or I guess because I know like that recovery is like it's like a long journey, like
Mhm.
people like relapse and stuff. So just like what is usually like the treatment like process
Mhm.
like, I guess.
So for us, because we work with teenagers and young adults, we are really honed in on making the recovery process fun and enjoyable. You know, um, for a 16-year-old, if it's not fun, they're not doing it. And so everything that we do is built up from that platform that recovery has to be attractive. So when someone goes through our treatment program, we're doing a variety of doing 12-step counseling, doing emotional coping skills, working with their self-esteem. Um, think it we probably, whether it's going to the movies or going camping or going to the beach. I mean, every weekend we're trying to do something fun and interactive for them. And so the idea is when a young person goes through our program, typically the first 2 to 3 months they're in more the intensive phase of the treatment where they're coming up for counseling, usually daily, group therapy, individual counseling, and whatnot. But while they're going through that for the first couple of months, they're also attending our support group. And that peer interaction is so, like, that positive peer support system is such an important part of the recovery journey for anybody struggling with a substance abuse issue, but especially young people. So during the intensive part of the program, they're going to the support group 4 nights a week. On Mondays and Thursday nights, we have our 12-step meetings, and Thursday night includes the parents. And then every Friday and Saturday night, we have planned activities. Like I said earlier, we're going bowling, we're going to the movies. We're always doing something fun every Friday and Saturday night. There's roughly, I think, like right now, there's 60 kids that attend that 4 night a week support group. That's all kids that have successfully completed our treatment program that have anywhere from a couple months sober in recovery to up to as long as a couple years sober. So the whole idea is while they're going through the treatment program, they're attending the support group several nights a week, making friends with all these kids their age that have practiced staying sober. So once they get out of the initial treatment, which, like I said, typically lasts a couple of months, they can continue utilizing that 4 night a week support group and peer connection for up to a year or two post discharge from the treatment.
That's really cool. I mean, that's really interesting that like, you try to make it fun, because that does definitely help. And I hadn't thought that treatment
Oh
centers
yeah,
were good at that.
super important. Yeah,
Yeah.
like I remember, because I'm old, right? I'm 45, and when I went through drug and alcohol treatment in the 90s, some of my friends that I was getting high with had gone to treatment before I did, and they had such horror stories of treatment. You know, they got sent to you know, the military boot camp or the lockdown inpatient hospital. You know, like out of the movies. You know, is what it seemed like when they described it to me. And you know, they would talk about how horrible rehab was, and then when they got back, we would get high with them. You know, and commiserate with like, man, that sucks. I'm sorry your parents sent you to rehab. You know, and so um, making recovery and drug and alcohol treatment for young people a positive experience that they enjoy uh, makes all the difference in the world. And you're really bringing them in through attraction. Now, 90% of the time when mom and dad bring their kid in to see me for the first time, he or she was kind of drugged by the ear, you know, to some extent. Um, but it's after they talk to me and they meet the other kids or they talk to one of the counselors and they see the program that they're thinking, well, I know my parents are going to make me do something, and this place kind of looks fun. So I guess if I had to do something, maybe I'd be willing to do this.
Yeah. What do you think? So, like, I guess the first step of like recovery and the whole treatment is going to the rehab center. And so, how do you think would be the best way? Like, I guess it's a two-part question. So, first, like, what are, I guess, signs or symptoms of someone that is going through addiction? Because it's probably not something they're open about. If you
Sure.
like, how would you notice that? And then how would you ask them to get help, or how would you get them help, or take them to some sort of rehab center?
So, I mean, signs and symptoms can vary depending on the drug, depending on the person. And, you know, I do a lot of speaking engagements like at churches and schools where I talk to parents. And, you know, you kind of go through the list of signs and symptoms of drug abuse. A lot of those can mimic just normal adolescent rebellion, you know, like wants to be alone in the room and, you know, sudden change in behavior. So that's just being a teenager. So, I always tell parents to take that list with a grain of salt. But yeah, usually sudden changes in behavior can be, you know, frequent and sudden mood swings, um, uh, you know, dilated pupils, pinpoint pupils. Obviously, the classic kind of red eyes with THC use. Bloodshot eyes would be a better way, I guess, of putting it that. You know, slurred speech, um, you know, a lot of increased anxiety, depression, isolation, you know, kind of change of friend group, can all be different signs and symptoms, just to name a few with young people. And that list can go kind of on and on. Of course, all of those don't necessarily mean that someone has a drug and alcohol issue, but it can. Um, if you know someone or you recognize someone does have a substance abuse or substance misuse issue, um, and you want to try to get them help, so if it's um, if it's welcomed and they're asking for advice, um, there's a lot of really good clinicians, therapists, treatment centers just in the Atlanta area. And no program and no counselor, no therapist is a one size fits all. So it's really finding the right program, the right therapist, the right clinician for that particular person. And sometimes that might be going and checking out several facilities or going and talking to several therapists and counselors to really find the best fit for that particular person. And most treatment centers and therapists are really open to that process and understand that not every program is going to be for every kid, or for every person that has a drug and alcohol issue that needs help.
Okay.
So, is there like a common reason you usually see for people, like when they start to use drugs? Like, is it mainly just like they just want to like party with their friends, or is there usually like more of like mental health issues going on behind it?
Mm-hmm. So that's a great question, and I get it a lot. And the answer is kind of two parts. So obviously, someone that has a substance abuse issue, there's usually deeper things going on, right? Um, Mental and emotional health, you know, low self-esteem. You know, you can get into genetics with, you know, addiction running in families. There's a lot of, you know, kind of underlining issues that when we are treating someone can see that need to get addressed. However, this is my big however. If you were to come up to Insight today and interview all the kids that are in treatment and ask them, now I should say ones that are newer to recovery, obviously ones that are further along, they've started to embrace the counseling process and look at some of the more underlining issues to why you know, drugs became a problem and were probably more of a symptom of the problem. But if you were to come up and ask, let's say, a number of the kids in the program that are in their first couple of weeks of being here, why do you do drugs? What do you think the number one issue, or what do you think? I'm sorry, what do you think the number one answer is?
I don't know.
Probably like
Think
mental health issues.
think like a no, think like a teenager. What do you think the number one
Their
answer is?
friends do it,
To be
maybe.
cool.
Close. That's definitely what gets them into getting high, is that negative peer pressure. But we're talking about kids that have already got into that scene, they're past that point, and you go, well, why, you know, think of a 16-year-old that's in my office for the first time, and you just ask him, why do you do drugs? What do you think his first response is? It's a 3-letter word.
Fun.
Bingo. Yeah, that's almost always when you why they think they're doing what they're doing. Yeah, obviously, when you get way more into the addiction and despair, there's a lot more pensive thought with that. And then even with the teenagers that come in saying that I do it because it's fun, there's deeper issues going on. But in the, you know, I guess on the, you know, in the front of their mind, they're thinking, I just get high because it's fun. I don't have a problem. I'm not. There's nothing wrong with, you know. It's fun. All my friends are doing it. You know, this is what we do. And to be honest with you, when I was getting high as a teenager and it was a problem and I did wind up in treatment, I was having fun. Getting high was fun. It caused a lot of problems in my life. It caused a lot of harm, but it was fun. I'd be lying to you if I told you anything different, you know?
Yeah. So but that also kind of leads back to the issue on why it's important for like education in like the right way, instead of just saying, don't do it because it's bad.
Drugs are bad.
Yeah. Like that's not gonna stop someone from again having fun. Like it's just, you have to talk about the negative impacts.
And teenagers are fun machines, right? You know, like that, like what's the number one motivation for most things teenagers do? It's fun, you know?
Yeah. I think that was most of our questions. Unless Kylie, if you have anything else.
I think you pretty much touched on everything that we wanted to ask you. Yeah.
Yeah, this was
Great.
really helpful and insightful though. So thank you very much.